Hi, I'm Nicole Marstall, and I will be presenting case study 4 today. The client that we will be discussing today is male. He is 6.5 years old, and he has a diagnosis of autism spectrum disorder. The behavior concern I will be presenting is furniture climbing. So let me describe the behavior a little more in depth for you. The operational definition of furniture climbing is using hands and or feet to get on or attempt to get on furniture, equipment, or other structures in a way that is not in accordance with their function. An example of this would be using hands and feet to get on top of a table and standing on it. Another example would be using hands and feet to scale up a slide rather than going down it. The examples would look different topographically or in appearance. However, both are in the broader response class of the problem behavior that is climbing furniture. Some non-examples would include using hands and feet to go up a ladder or scaling a rock wall. In both of these non-examples, the client would be acting in accordance with how these things are intended to be used. The behavior was a concern due to rule-governed behavior. It is taught that climbing on furniture or other structures that are not intended to be climbed on could be dangerous and result in injury, or that it could also damage the furniture or equipment when not used appropriately. This would be rule-governed behavior, as it is something that we are taught. We are told early on that these things could be dangerous without someone experiencing or witnessing injury or damage firsthand. For the intervention, we used a simple correction procedure. First, we were to attempt to block the behavior when possible. If it was unable to be blocked, a simple correction statement was given. For example, if the client was climbing up the slide, we would say, "We go down the slide." Then we would provide least to most prompting as necessary to gain compliance with the corrective statement. Along with the simple correction, we also implemented a differential reinforcement of alternative behavior known as DRA procedure. During this procedure, a timer was set for 5 minutes. If at that time the client was engaging in alternative and appropriate behavior, they were provided behavior-specific praise verbally, accompanied with a small preferred edible. Behavior-specific praise would include phrases such as, "I like how we are sitting in our chair," or "I love how we are going down the slide." We were able to positively reinforce the client for engaging with the equipment or furniture in appropriate ways. And then, as the instances of furniture climbing decreased, the timer was set for longer durations of time. The outcome of this procedure was successful, as instances of furniture climbing have been on a downward trend. Increasing time on the DRA timer did not result in an increase in behaviors, and time has consistently been increasing on this timer as well. One of the obstacles during this intervention has been that there are times when the function of the behavior of furniture climbing has been hypothesized to be attention-based. The obstacle with this is that attention has to be given sometimes, as allowing furniture climbing could be a safety issue. However, giving the attention could also potentially reinforce and maintain that problem behavior. Although attention was hypothesized in some instances of the furniture climbing, the effectiveness of the procedure has maintained its overall effectiveness. This is seen because there is still a downward trend line as instances of furniture continue to decrease. Thank you for listening to this final case study.